All right, hello everyone and welcome to our UN Behavioral Science Group session on impact evaluation and behavioral science in the UN. For those of you who are new to the UN Behavioral Science Group, my name is Mary McLennan. I lead the UN Behavioral Science Group, and I also am the Senior Advisor on Behavioral Science to the Executive Office of the Secretary General. And I'll come to shortly why those two roles exist, but we have a really packed session today with some great speakers, and a really topical area of discussion that we'll dive into shortly. So I'm going to start with a few slides to give us some context, then we'll get it over to our panelists for today. So as I mentioned, the UN Behavioral Science Group is running this webinar. The group brings together over almost 7,000 members from more than 70 entities in 150 countries. So we're quite a big and growing group. Colleagues range only across these different geographies, but also with respect to domains like health, climate, gender, peace and security, and we'll cover some of those today. We also have some colleagues who are new to their behavioral science journey, and others who are more advanced. And we'll hear from some of those more advanced discussions today. But to say the group consists of people who are along the spectrum of the behavioral science journey. So if you're here, there's a good chance you know about this agenda. It's called the UN 2.0 agenda. It's put forward by the Secretary General, really a vision to see the UN more nimble and effective and fit for the 21st century. So it's about embedding these 5 skills into the work of the UN. So data, digital transformation, innovation, strategic foresight, and of course, behavioral science. So it's about a forward-thinking culture and really seeing more colleagues doing this and carrying this out throughout the UN. So that's UN 2.0, and we'll share some links with you if you want to know more about the group or UN 2.0. Yes, the links will not only cover those 2 areas, but also some of our publications. So collectively across the UN and with partners outside, we've produced a number of publications over the years, including Secretary General's Guidance Note on Behavioral Science, UN Behavioral Science Report, UN Behavioral Science Review, which features case studies across the UN, also the UN Practitioner's Guide to Getting Started with Behavioral Science. So lots there to check out, and I'll put those in the chat for you now or in the next few minutes. And then also, if you haven't already, you can click on the links in the chat to join the behavioral science group. Share with your colleagues, your friends. The group is for colleagues in the UN, but we also have observers outside the UN. So you get invited to discussions we have, events we have, and various other things that are taking place. Okay, so one thing to just note for now, in terms of what the group is doing, is every year for the last 6 years, this will be our 7th year, we've hosted a UN Behavioral Science Week. So this year it's taking place in April, so a little bit earlier than usual, and it will feature over 40 UN entities across, I think, about 16 events. So stay tuned for that. Join the group, and you can get updates on that. And it will be free, open to everyone, and available online as well, no matter where you are or what you're doing. Okay, so that's that. Now on to today's session. So the way we'll run this is we'll hear from our speakers. They'll speak for about 10 minutes or so each, and then we'll have a lot of time for questions with all of you in a discussion together. So in order to keep this Q&A a little bit organized, we're hoping to collect questions from the Q&A box in the bottom of your screen. So don't put your questions in the chat. We won't be taking them from there. Put them in the Q&A box. You can also upvote the questions of your colleagues if you don't have one yourself. So just keep the Q&A box in mind throughout, and hopefully this is a really open discussion and conversation. This is not meant to be a super formal session. It's meant to be a kind of a real conversation about the topics of today. Okay, so our speakers. So first we'll hear from Eduardo Gustale from UNDP, who has worked for a number of years in UNDP Accelerator Labs on experimentation. So he'll cover some of the interesting ways in which Accelerator Labs has applied experimentation in many different contexts. We'll also hear from Katrin Habersat from WHO Europe, who leads the behavioral science initiative there and has done quite a lot of work over the last few years. So she'll speak to some of the bigger pieces, but then we'll also hear from Professor Philip Schmid from the Radboud University. Oops, I don't know what happened there. Let's go back. And he'll speak to some of the work that WHO Europe has done, thinking through evaluations, particularly when it comes to behavioral science angle. And then finally, we'll hear from Michel Dugas from the World Bank, who's for many years worked in behavioral science and carried out a lot of work when it comes to impact evaluation. So part of the EMBED team, the Mind Development stands for unit there. as well. So with that, I'm going to stop screen sharing and turn it over to Eduardo. Over to you.
Thank you, Mary. I'm gonna share my screen. Do you see it?
Yes. Oh, yeah, perfect.
Great. So thank you so much for the invite. I mean, we're gonna talk a bit about a huge behavioral science related project in the UN system called the UNDP Accelerator Labs. Just a quick introduction of what we are before we get into kind of some of the details. The UNDP Accelerator Labs is it's a initiative that started around 5 years ago, which basically looks to build a learning network, which consists of 90 social innovation teams embedded within the country office of UNDP. And this is very relevant because we're talking about almost 300 colleagues that joined the UN system. 50% of them didn't work for the UN before, actually more than that. And these are like completely new skills that are now part of UNDP. And when we talk about that relationship with behavioral science, I mean, here we are talking not only about data scientists, economists, but also kind of ethnographers, anthropologists, sociologists, and even like designers, etc. So the human centricity of this initiative and the fact that it has an experimental mandate makes it very relevant for kind of the behavioral science efforts that we're now going through as part of the quintet of change. In a nutshell, each lab, I mean, what makes a lab? It's a set of three key methods. Not only this, but these are the key. One is a heads-off solutions mapping, and this is pretty unique because we're talking about 90 colleagues and inside UNDP whose full-time job is actually going to the field and learning from grassroots innovators, from people that are closer to the problem. So think about an innovator that's solving an issue where the market or the government has not been able to provide a solution. The aim here is to map the solutions and understand, not from a perspective of taking the solution to scale, but actually just understanding from people closest to the problem. The exploration mandate is more around kind of anticipatory stuff, kind of bringing out the periphery into the country office to better decision making. This is about futures. This is about data driven initiatives, and collective intelligence is kind of transversal in the sense that the labs are really pushing this practice forward, and understanding what it means to be smarter together, especially with the use of new information technologies. And experimentation, I mean, there are also heads of experimentation in each of these labs, and this is a little bit what I'm gonna talk about. What do we mean by experimentation in the network? And also, I think a relevant point is that each lab works as a network. So we are a network of 90 labs. We like to see ourselves as a network of ecosystems. And also each lab has a decentralized mandate. So what they work on is really up to the country office. It has nothing to do with a top-down approach of, focus on this thematic area. It's really a bottom-up perspective to working in development. So what do we mean by experimentation? In these 5 years, we have around 800 experimental activities documented. And when we think about experimental activities, this is a whole range of stuff. Here to the left, you have kind of proof of concepts, where we don't really know what the outcome looks like. This is about just, testing out something new. We, of course, have, prototypes and pilots, and also have an interesting range of fully randomized kind of experiments. When you look at kind of how are these distributed, we see that the big bunch lies in prototypes and proof of concepts, and we also have fully randomized activities. This is natural. I mean, we do have to balance timing, budget, and just running experimental activities which are fully randomized. It's costly, of course. So we are not closed to only that types of experiments. This is really an experimental mandate that is broad and decentralized. In that sense, we're really able to learn about what it takes to embed experimentation inside an organization like UNDP. So here is kind of some of examples and how they relate to behavioral science. A proof of concept, I mean, something very, very simple in UNDP Guatemala is actually separating waste to kind of worth it. This is an approach directly working with our communities to try to understand their perceptions, again, activating agency or what it takes to activate agency in terms of really making recycling a priority. So before moving into like a full in activity on this area, they just went ahead and asked these questions to the community that we're trying to work with. We also have kind of the validation of new methods. So it's testing the value of satellite imagery in Guatemala in terms of waste collection. This is not about kind of the use of satellite imagery. This is how humans, interpret that data, how communities can use that data for decision making, and empower communities with this type of new data. We also have, for example, this pilot, very interesting during the pandemic in Jordan, where they were kind of exploring what it takes or how gender roles and social norms were shifting during the pandemic, and what does that mean? What does that mean for the country, and what does that mean in terms of kind of trying out different initiatives? Of course, the famous, social media messaging and behavioral nudges, this time aimed at improving waste collection. So in UNDP Philippines, they did a very interesting randomized sampling of different types of messaging, what it takes to get people to recycle. And this was controlled by age group. So how different types of messaging works with, different types of age groups. And then on the fully randomized scope, testing out mobile justice in UNDP Guinea. I mean, this was very, very successful from the perspective of scaling because it's now rolled out nationally. And I think the important takeaway from this experiment is that the public sector was involved. So what does it actually take to experiment in the public sector, which is not very common. And then also food vouchers in Paraguay, how using food vouchers actually led to people to increase their nutritional intake. And probably we're going to present some of these cases in detail during Behavioral Science Week. So what are the challenges? I mean, what does it actually take to embed experimentation in our day-to-day work? And the challenge, I think the main challenge is this paradox, right? The balance between speed and rigor. We would like to call it kind of feasible rigor, right? The fact that we need to balance budgeting, we need to balance, we're called the accelerator lab because the idea is to work in a certain speed. Our learning cycles are usually around kind of 3 months. And of course, the rigor of actually kind of proving impact of your activities and increasing kind of the inference value of what we do. So this is, I think, the main challenge, and I think one that we have learned quite a lot on. So what does success look like when you are embedding experimentation? I mean, it's really difficult to assess an experiment as a failure. I mean, the only experimental activity that is a failure is one that you actually haven't learned anything from. So the way we were thinking about kind of assessing the value of what we do is to try to understand what really happened after these experiments kind of ended. And what we see is that around 68 or 70% of these experiments actually led to a specific outcome. So that's one big intake where, these outcomes could be influence in policy, the actual scaling of the solution we were trying out. Partnerships is a big one. We found that to get, this is why I have the number, 1 in every 4 experiments was done with the private sector. It's difficult to engage the private sector in development related activities. And we found that, that experimentation is an amazing way of testing the water and getting private sector companies involved. And through this experimentation process, then that leads to more meaningful partnerships. Of course, resource mobilization, and then finally testing out new ways of working. What do we mean by testing out new ways of working? This is, embedding foresights, for example, in the public sector. So actually trying out new methods. And we found out that, we first run an experiment and then that hopefully gets embedded with our partner. And, there's also a 32% of experiments that really didn't lead to any type of outcome. This is not a failure in itself. This is just, something that didn't, wasn't follow up, but also speaks to this experiment, that real experimental nature of this work. And then to end on a quick note, we did do a midterm evaluation. I strongly recommend you to actually go and look at how was a huge experiment in itself evaluated a few years ago. And we really took that midterm evaluation, the recommendation seriously, and tried to kind of steer the second half of the project. And then finally, we are now designing the final evaluation. This is an invite for anyone that wants to get involved or has any questions or just want to participate in this process. I think it's an amazing opportunity to assess the value of really embedding behavioral science capabilities into an organization like UNDP, and what does that lead to? Of course, going beyond accountability, going just beyond evaluating what we said we were going to do, into actually what are the insights that help us reimagine development for the 21st century and actually strengthen as our offer as UN agencies. So with that, thank you. I'm open to questions and especially open to people wanted to join us and help us with this final evaluation process. Thank you very much, Mary.
Great, thank you for that, Eduardo. We can maybe turn your camera on during the chat, the Q&A function of part of the session. So thank you, super insightful about how to do this in practice, how do you work with the public sector, the private sector, what does success look like? It's not just the evaluation, it's where you take things as well. So super interesting. Maybe just to say, I put the Accelerator Labs website in the chat, so if you wanted to share more, feel free to do so for now. Also, there was a question about Behavioral Science Week, so Eduardo will be there speaking more about this topic. So as you said, so there'll be more to come. It'll take place, it's virtual, it's online, it's actually not in New York. There's a question about that as well. With that, now over to our second speakers for today, Katrin from WHO Europe. Over to you.
Thanks so much, Mary, and thank you, everyone. So I am Katrine Bakker-Habersø, and I lead the unit for behavioral science and the cultural context of health behaviors in the regional office in the World Health Organization for Europe and Central Asia. And our unit works really very closely together with our member states. All of our 53 member states in our region have appointed behavioral insights focal points. We meet with them every other month in our community of practice. And when they ask for our support, we help them also with in-country projects on behavioral insights for various health behaviors. And in that, we're always applying an approach that we developed, a guidance document that we developed that we called the Tailoring Health Program. So indicating that, of course, if you want to be successful in addressing health behaviors, you need to tailor your interventions to the evidence and to the context. And so this Tailoring Health Programs, and I'll put a link in the chat, really devises that process step by step and with a lot of guidance and tools. And one of the things that are BeSci focal points, behavioral insights focal points, that they come back and say to us is impact evaluation is really, really difficult. And we need more support, we need more guidance, we need more capacity building. So in response to that request, we worked in the unit with Tina Licky and Philip Schmidt to develop some guidance on this as a supplement to the Tailoring Health Programs approach. And so what I want to do now is really just to hand over to Phil to provide a little bit of an overview of some of the key tools of that document. Thank you.
Thank you so much, Katrina, and thank you very much, Mary. It's a pleasure to present this document to this vital group now. And I hope that you can see the slides. So I'm presenting the Evaluating the Impact of Interventions Addressing Health Behavior Guide. And if we have a first look at the table of contents document, then we see that this document is basically structured in two bigger parts. The first part called Considerations for Impact Evaluations, which is also reflected in headlines in the navigation top headers, such as considerations and checklist, and I come to that later. The second part really is a toolkit part where we provide practical tips and toolkits for people interested in impact evaluation, and that is also represented in the headlines such as toolkit. Now, the first part of the document really is about making people aware of the necessity of impact evaluation and encourage people to really do this. It also provides people with key terms and also insights on what is impact evaluation actually and what do I need to know before I engage with an impact evaluation expert and choose a specific context-specific design for my impact evaluation. Now, the bad news here is if you read this document, it's not going to turn you into an impact evaluation expert. We still recommend to talk to someone about this who is actually an impact evaluation expert, but it will give you the insights to actually do these discussions in a more fruitful way. Now, in this first part of the document, we talk about why to evaluate, and we have lines like avoiding potential harm, saving money, adapting interventions, detecting ineffective interventions, and informing policymaking. Now, in this presentation, these are just headlines, but in the document itself, we provide a variety of different country-specific examples and also peer-reviewed scientific evidence on why we think impact evaluation matters. We also raise the question of when and what to evaluate and help in the process of deciding these questions using a theory of change and also, again, country-specific examples. And we provide, well, an answer to the question of how to evaluate by introducing randomized controlled trials and natural experiments and subforms of these so-called gold standards of causal analysis of impact evaluation. Now, while these are more quantitative approaches, they often do not answer the question why did an impact evaluation or an intervention now work or why did it not work? So we also provide information about, for example, qualitative research that can be used as an add-on to more quantitative causal research designs to help find out why did it work and why not. Now, at the end of the first part of this document, we provide the first tool, which is a checklist that makes this entire document adaptable to your specific knowledge level. Meaning if you know a lot and you can answer basically yes to all of these questions in the checklist, then you can already go to your evaluation expert and discuss a specific research design for the field. If you are saying, well, kind of, I answer no to some of these questions, we provide tools in the second part of the document, the toolkit box, that provides more knowledge on things like designing a research question, what is a power analysis, what is pre-registration, but also choosing a specific research design for the specific context you are in. That is basically the toolkit box. Meaning the second part helps to identify which evaluation design might be most appropriate and also how to improve the quality of evaluation practices, and it provides more in-depth information and links to further resources. One of the key tools in this toolkit is a decision matrix for policymakers that we see here. And it looks kind of overwhelming, but I will run you through it. So first of all, what we see here is a set of specific statements, 1 to 5. And you can answer yes or no to them. And depending on your answer, you either go to the next step or you can already basically exclude specific research methods. So, for example, there are certain evaluation designs that may be excluded based on your answers. You can see that by looking at these red crosses. For example, if you read the first statement, the intervention has already been implemented, and you answer yes, then the following designs are excluded, meaning crossover, stepped wedge, and randomized controlled trial. All of the randomized controlled trials, basically, because you cannot randomize if the intervention is already in place. So this helps you excluding some of the research that may be possible before talking to an expert. Once a design in this matrix is excluded, it remains excluded throughout. That is important to know. So if I've excluded crossover designs in the first step, then it doesn't come back in the second. I know now it is not one of the options that I should invest more time in. If more than one specific research design is left over, then you can use this basic statement to further evaluate the quality of the research designs. And this is just some sort of guidance. It is not a dogma of what is better for your specific context, but it helps you to decide. I want to give you one specific example to make this clearer. We have the following example. Neighborhood A receives funding for residents to engage in physical activity. The decision to fund this neighborhood is made, and there is no possibility to intervene. Out is happening as planned by the state. The neighborhood was chosen because it has an especially low health index compared to other neighborhoods, including a high average BMI score. Now, with this setting, we can run now the decision matrix. First of all, the intervention has already been implemented. I can answer no, because in this specific setting, the state has not started building new facilities and providing opportunities for free. Thus, all designs are still possible, and I can go to the next step. Group comparison is possible. Yes, group comparison is possible because the neighborhood can be considered a group, and there are other similar neighborhoods, so all research designs are still included. Is randomization possible? No, in this case not, because the state has already decided which neighborhood is the treatment group. So we cannot decide that, meaning crossovers and randomized controlled trial are excluded. Then outcome can be measured before implementation. Yes, that is possible because we already have data given the example. And the last question is, intervention can be undone. Well, this is about building facilities, and it's really difficult to undo them afterwards and maybe even unethical. Thus, we can exclude, in this case, one of the natural experiments. This leaves us with three options. If we want to further down the line decide more, we can see that the difference in difference approach actually has the highest quality of all of these three options. Now, again, this isn't a dogma, it's just a navigation tool that you can use before deciding which research method you want to apply, and it should help you. If you don't find it helpful, or after the first part of the document you decide, I already know enough about this and I don't need more information, just go contact your research design expert and then decide on a specific setting that is best for your context. Thank you.
Thank you for sharing that, Philip and Katrin. Really, really interesting examples to get us oriented, especially those who are new to evaluation, how to get started and what possibilities are out there in terms of navigating. But as you said, we would suggest that you speak to somebody who has experience in this, not just to simply go through the guide as well. Okay, so next over to Michelle from Embed, which is the Mind Development and Behavior Unit of the World Bank. Over to you.
Great, thank you, Mary. It's a pleasure to be here today presenting on how we leverage impact evaluation and behavioral science at the World Bank. And following the presentations from my UNDP and WHO Europe colleagues who did, an excellent job of providing an overview of how they approach impact evaluation and key principles that they follow throughout the process, I'm shifting gears a little bit to focus more on a presentation of a case study on piloting behavioral solutions to promote clean cooking in Rwanda, in which we conducted a large-scale impact evaluation. And the aim will be really to show you how we approach critical questions in designing and implementing impact evaluations, including how we approach defining, what to test in an impact evaluation, as Philip kind of highlighted in his presentation as well, and how we conduct impact evaluations. But before jumping into the case study, I am going to very briefly introduce what we do at Embed. So just a little bit about Embed. We're a development-focused and applied behavioral science unit at the World Bank, meaning we work with World Bank teams to try and improve the effectiveness of policy by incorporating behavioral insights that might otherwise be overlooked. And now we're actually currently housed within the Development Economics Impact Group, which is completely dedicated to evaluating the impact of public policies So you can understand why I'm so excited to be part of the webinar today, because impact evaluation is something that we really think is essential to developing effective policies for our most pressing challenges. So how do we do this at Embed? I'll very briefly review kind of the behavioral process that we follow that is nicely illustrated by this infinity loop representing the iterative nature of our work. But if you're interested in learning more, we produced a nice toolkit that's highlighted in the bottom right corner that I can share that provides more guidance and tools for each of these steps in detail. So first, we begin by defining the problem, where we draw from desk research, stakeholder consultations to define a concrete problem, statement, behavior of focus, and outcome of interest. And with this, we then move on to the second stage of identifying or diagnosing key barriers as well as enablers contributing to the focal problem, typically using mixed methods research, including extensive qualitative research. And then we move on to mapping the solutions to identified barriers, drawing from literature review, behavioral frameworks, and existing evidence. And with a longer list of solutions, we aim to prioritize them following considerations like potential impact, feasibility, and opportunities for scale. And ideally, in this stage, we can already incorporate some small-scale testing to refine the design of our solution. And it's really through these 3 steps that we shape our ideas of what to test before proceeding to the 4th stage, which is kind of the star of today's webinar, which is implementing and evaluating. So at this 4th stage, we aim to roll out the solution and evaluate impact with pragmatic but rigorous methodology. And as Eduardo was highlighting, for our team, it's really important to be pragmatic in our impact evaluations, trying to balance constraints and resource availability with the needs for designing an evaluation that is rigorous enough to produce knowledge and evidence that we can be confident in. So our designs range from quick A/B testing on the impact of behavior change and communication online to large-scale randomized controlled trials like the one I'll walk through today. And finally, we aim to scale our insights by integrating findings into public policy and operations, either in the context where we tested, but also consider adapting interventions to new contexts that might face similar problems and constraints. Okay, so I know I very quickly covered a lot of information about our process, but I'll refer to this process while reviewing this case study on piloting behavioral solutions to promote clean cooking in Rwanda. So very, very briefly going to cover some of the insights from those first 2 stages of defining the problem and diagnosing barriers. So just to give you a sense of why we engaged in this project, in Rwanda, 94% of the population uses biomass, mainly firewood and charcoal, as cooking fuel. And this has major implications for climate, environment, but also importantly, the health of the population due to air pollution. But 80% of the rural population is expected, or the goal is to transition 80% of the rural population to clean cooking by 2030, but progress is slow. So when we talk about transition to clean cooking, we mean adoption of cleaner fuels. So things like, gas is cleaner, electricity. And this requires often adoption of new technologies, right? So our goal in this project was to help the World Bank teams who are supporting operations to help design, subsidies and ways of improving adoption of clean cooking technologies and practices to help them understand the different factors that might be contributing to why people aren't making the shift. And to address this problem, many of the solutions so far have focused on technology development, financial approaches, which are important and much needed. But the pace of progress hasn't been sufficient. So our idea is that the adoption of clean cooking can be accelerated if we improve, if we include how the household decision-making process is considered in the design of these programs and solutions. So we conducted diagnostics, including analysis of survey data, qualitative data, and found a number of behavioral barriers that could be contributing to the slower adoption of clean cooking. One being awareness or lack of awareness of the benefits of clean cooking. Second being kind of mindsets that people have about what foods are good for different types of stoves. And in particular, the belief that certain staple foods had long cooking times, which made them unsuitable for cooking with cleaner, more expensive fuels. In their view, cooking something like beans with cleaner fuels would be like burning money because the perception that so much fuel would be needed for this task. And of course, taste is important, the perception that taste will change if you change fuels. So based on these insights, we really narrowed in on this idea that staple foods are an important kind of barrier to the complete transition to cleaner fuels. And in particular, we focused on this idea of beans because they're cooked frequently in Rwanda, they're cooked over a long time, and they're primarily cooked over charcoal or firewood. So we wanted to explore this idea of whether if we could introduce soaking beans in households, which was not a commonly practiced cooking technique. Most people just cook the dried beans. But if we could introduce this idea of soaking beans, households could reduce their cook time by half, making the beans more suitable for cleaner fuels, but also just, reducing the amount of biomass fuel, charcoal or firewood, that people use if they don't own cleaner cook stoves. So we considered it a kind of an easy, quick win for households to adopt. So with this idea in mind and kind of a refined problem and challenge that we wanted to focus on, very specific on this bean soaking idea, we proceeded to the designing solution phase where we aim to optimize our solution design by following different steps. So mapping the barriers to potential solutions, prioritizing the different solutions, considering those factors of potential impact, feasibility, designing the solutions within the constraints of the program that we had in mind, and then also trying to do a very brief A/B test of a small number of solutions to learn and iterate on our design ideas. So to do this, we conducted a small A/B test in 5 villages with 20 people per village, so just 100 households, trying different behavioral solutions that we identified based on our review and our prioritization exercise, including providing simple information about benefits, providing a real world demonstrations of what bean soaking is like to households, introducing some household resources like a calendar, engaging in a commitment device with a pledge, and peer engagement with a WhatsApp group. We followed up with the households 3 weeks later, and we derived some insights from this activity, deciding, we could tweak some things, drop others. So, for example, we ended up dropping the idea of the WhatsApp group because we found it just wasn't really fully feasible with many households not having regular access to a smartphone, even though the people that did have the smartphone actually were really engaged in the group, which was interesting. So we took these insights, refined our design for our kind of final large-scale pilot rollout, incorporating everything into a kind of all-in-one booklet or calendar iteration that we use to guide community sessions, introducing this idea of bean soaking, the connection to cooking on cleaner fuels, and the different benefits involved, as well as kind of a tool that households could use in their household as a reminder. So with this refined design, we then moved on to our final, stage, which is very exciting always, which was implementing and evaluating the design with a large scale pilot. And of course, this isn't always something that we get to do with all of our projects. As was mentioned, there's always this tension between the resources needed to do this kind of evaluation, as well as, the return on investment of what we can learn. In this case, we were able to conduct a large-scale pilot with over 2,800 households, sampled from 400 villages around Kigali. And we focused on the peri-urban villages around the center of the city, where we saw a very high usage of charcoal. And we randomized the assignment of treatment and control, where the treatment was this kind of community session group, introduction of that calendar we reviewed by village, because we were doing things in a group setting. So that made sense. And then in terms of how we evaluated the outcome or impact of the intervention, we followed up with the households 8 weeks after the intervention period. And this was a self-report survey, but we also tried a little bit of triangulation, installing sensors on cook stoves for a subset of the sample. So with that, we then kind of analyzed the data and found that there were some positive signs of impact of the intervention, where we found that the intervention reduced cook times by 30 minutes for charcoal and firewood stove users, which was kind of our goal. We wanted to introduce this bean soaking so that households would spend less time cooking this very common, typical staple food on their high polluting stoves of charcoal and firewood. And then kind of with that learning, there's always the question of, okay, now what? So how do we make, we just invested this money. How do we make the insights from this study valuable? We do have plans for scaling some of these insights and translating them into policy through program integration with the Rwanda teams that were involved in the kind of the conception of this study, but also replication and adaptation in other contexts. In this case, Chad, where biomass fuel is also common for for cooking tasks. And here, what's interesting in the Chad context is that it will be integrated into safety net programming. So we have kind of the balance of the behavioral side and the tools and tricks that we have there, but also some of the structural needs of providing cash and money to actually help the transition toward cleaner technologies. So then I'll end there and excited for questions. Thank you.
Great. Thank you, Michelle. Thank you to all of our speakers. Maybe you can stop screen sharing. That'd be great. We can maybe turn all our cameras on. We have a lot of questions coming in the Q&A box, so we'll try to synthesize some of them. But if for our panelists, if you see some dedicated to you in your presentation, feel free to jump in and respond to them directly. Great. Good to see you, Eduardo. So maybe I'll just thinking about some of the themes that have arisen in the question. So there's a question around, maybe it's a broader one about when doing these sorts of evaluations and how you define them in your organizations, what kind of skill sets would you suggest that people have? We've talked about, it's important to work with people who've done this before. What kind of skill sets might you recommend? And there are also quite a few questions around how do you work with others, whether it's the public sector governments, whether it's consultants, whether it's universities, maybe how you form partnerships too. So related to that skill set question, how do you do these evaluations that you spoke to? So who wants to go first? Maybe we'll go back. We'll go the reverse order. Michelle, over to you to start if you have some comments on this question.
Sorry, I was typing an answer to another question.
Sorry, no worries. We can go to Eduardo first. Maybe we'll do that while you finish your yeah, go for it, Eduardo. Oh, I think you're muted. Sorry. Unmute, that'd be great.
But same here. Can you repeat, please? I was also
Oh, sorry. I
the...
did not too many questions coming through the Q&A. So the questions are, what kind of skill sets would you say are needed to run experiments within UNDP Accelerator Labs or within all of your work? What might you say to someone wanting to do an evaluation or an experiment? And then also, how do you work with partners, whether it's governments, the public sector, universities, or private sector as well? How do you engage with others to do this?
Super, thanks. I think in terms of the skill sets, what we find more than the skill sets is finding kind of the enabling environment to experiment, right? So there's so much information out there, and as we showed, the range of experimental activities is wide, right? So it doesn't take much to actually run an A/B test or a quick prototype. It might take a little bit more time and skills to actually run a fully randomized control trial. So it's more about kind of the experimental mindset than actual skills you bring or your previous professional background. That's one. So I think that's where the trick lies on, especially with partnerships. And again, this is difficult, right? Both inside the UN system where we use public resources, it's very difficult to create a mandate for experimentation. And same thing with the public sector, where usually there's no time, or there's no there's no environment to experiment, to try out new things, because the mandate lies somewhere else. And again, especially being very careful in using public resources to try out something that might not work. So having said that, on the other hand, I think the trying out new things is an amazing way of engaging new partners into the conversation. The argument I made is that it's a fantastic way to engage the private sector in getting involved in development, for example, and this doesn't take a lot of resources. It's just, let's try out something, let's see what works, what doesn't. And then as we saw in our own results, 30% of those experiments actually led to more meaningful partnerships. So that's a bit of what I would say. Yeah, in terms of the skills and enabling environment.
Great, thanks for that. I'm sure there's lots you could say on those topics, but maybe we'll leave it there. We'll leave it there for now. Katrin and Philip, what might you suggest? Philip, you're coming from an academic institution. You are a partner coming in. What for your experience as well, engaging with the UN and bringing different skill sets to the table?
Yeah, I think that basically just links to the question Eduardo just answered, because if you want to do something like this, and part of our document is also to encourage people to do it, you just need a team. You don't need to have your own research methodology all set and a statistical background in everything to run an A and B test. What it basically needs is someone who has a basic understanding in what A and B testing is, and someone who does understand the context. Because even if you are a statistician and you know a lot of research methods, if you haven't worked in the field, then that is probably also meant to fail. So it needs that combination of academic skill sets on research methods and statistics, but also knowledge about and experience about the field. And that's basically how we also work together as academics with WHO in combining these different skills and then creating evaluated interventions. But again, I think that even if you just have the idea of, yes, we should do impact evaluation, and that's the best start, there will be a way to do at least a minimum of impact evaluation, even though you don't understand the difference between randomized control trials and a stepped wedge design. It doesn't matter. There will be something you can do that is better than nothing. And having the data is actually what it needs. And then finding out a best way to analyze it is something for later.
Yeah, thanks for that, Katrin. Do you have some comments as well?
Well, I think the more complex the research design, the more robust it needs to be, because if we're just all jumping into this as beginners, we may produce results that are actually not correct, and so we do more harm than good. So I think if we are looking at some of the randomized controlled trial methodologies, I do think we need some expertise in the room, and we need to reach out. And I think your point, Mary, about reaching out to academic institutions and drawing on their expertise as we draw on Philip's expertise, I think is incredibly important. But I wanted to bring maybe an additional element into this, that we talk about impact evaluation here today, but obviously sometimes we want to have a much broader, maybe much more qualitative approach to evaluation. We want to understand the broader acceptability and quality and reach of an intervention. How is it understood? How is it received among those who were affected? And that requires a completely different set of skills, including qualitative research methods, engaging communities. And so I guess I joined the choir of our other panelists saying it's about a team with different skill sets, and then together we can get there.
I love that. Really, definition of behavioral science, bringing people together. Just maybe pause here for a second. So as we reflect upon behavioral science across the UN, the definition that colleagues have kind of coalesced around so far, at least in the group, is an evidence-based understanding of human behavior, but has two kind of components. So the first bit is like the different disciplines coming together: psychology, sociology, anthropology, economics, the behavior side. And the second part of the definition is the evaluation side, we're talking about today. So really important to say that it's not just the nice big experiments and studies we could do, but kind of the holistic approach that behavioral science brings to the table. That's a great point as well. Yeah, Michelle, do you have some comments on what's been said so far?
Sure. I think I'm in agreement with a lot of what our colleagues already said, where it's really a team science. And I think, thinking about those stages prior to the actual implementation and evaluation, you need a broad range of skill sets of people who might be familiar with qualitative research, mixed methods approaches, not only just the kind of econometrics of an RCT, for example. And then, of course, it's critical to have the people familiar with the local context on the ground, in our cases, working internationally. And in terms of partnerships, I think we've found it helpful to be connected with and consulting with the local civil society organizations, people who, academics in the local context who have both a mix of the technical and local knowledge as well.
Great, thanks for that. Yeah, there's a lot there to unpack about how you engage with local communities and how do we understand the context to do these sorts of the work that we're talking about today. There was a question in there on that, so I'm glad you addressed it. Okay, so maybe going a bit more practical now. So there are a few questions around how do we do, there's a question around the timeline. So it's great that we talk about these sorts of evaluations. How long do these often take? Well, maybe some understanding of the process behind that. There's also a questioning around resourcing for them and financing for these types of impact evaluations. I know we talked about everything from A/B testing to much more complex evaluations. Maybe some of the practicalities and comments you might have around not just the theories and methods, but doing this in practice for those who are considering maybe taking this forward. Katrin, I see you nodding. Did you want to come in?
Yeah, I mean, it's a difficult question because it completely depends on the context. The environment that we work in, I saw there was another question, how do you work with the local governments, the national, in our case, health authorities? We never work in a country as WHO on our own. We support our member states and the national health authorities in whichever country it is to conduct this work. And so our timeline very much depends on local structures and politics and interactions, and we just provide our support in that. Yeah, so timeline, research, resources, it's very difficult to give a clear answer. I think that will have to be it.
Okay. I guess the answer is maybe it depends. It varies, the standard academic answer there, depending what you're doing. Any other comments on that? Maybe some surprising things you found in running these evaluations, or anything that might be helpful for someone to know who's considering doing this, either when it comes to resources. There's also some questions around, yeah, how the funding of them as well. Do people are asking for them, or is this something that you're pushing for? Maybe some questions around that too.
Just something I would like to add that isn't very from a practical point of view, but also, again, justifying why we should do this. If we look at the money that these things usually cost, and of course that is completely context dependent, but it is often just a part of what the entire campaign intervention would cost, and knowing that something does work or does not work based on the evaluation will in the end probably save a lot of money, even though at the start it costs something. It will be less than rerunning a campaign that doesn't work for several years, and that's basically one of the arguments why we push for this.
Yeah, go for it, Katrin.
No, I just wanted to provide an example of that from Croatia, where we've just finalized a randomized control trial of various letters, reminder letters to people for colorectal cancer screening, for target groups for colorectal cancer screening. And it was very clear that the behaviorally informed letter had an impact. And so testing which letter type was more effective will inevitably lead to more testing and fewer cancer cases. But the interesting about this, and this is the financial element to this, we also tested whether actually including a home testing kit was more effective in terms of how many people then went and got tested in a clinic afterwards. And that the impact of that was actually negligible compared to how many people actually went and got the test anyway. And including the home testing kit is very expensive. So we were very happy that we were able to test this, because we actually found that what was more effective was not the most expensive solution. We thought we would find that it was more expensive and we would have to do an economic analysis. But in fact, we actually found that what was less expensive was more effective. So the economic argument here was very clear, and the investment in the test was a good one.
Yeah, there's a lot there to unpack about the communication of this as well. I think there's, and just to Michelle's point about maybe scaling up the last part of your presentation there, what do you do with the results afterwards? Do we just communicate them back to who we're working with, or how and what do we do with them? So I don't know, Michelle, do you have any other thoughts just more generally on your experience in that area?
I think in general, this is something that our team is trying to continue to find resources to dedicate more time to, because oftentimes it's also maybe a funding constraint where, you produce a particular knowledge product, provide maybe some feedback to the government counterparts of that particular team, but sharing the knowledge more broadly and finding opportunities to adapt in other contexts, so nobody's reinventing the wheel. That can still be a challenge, but I think for us working within the World Bank, we have certain networks that we can tap into, but we're also trying to do a better job of doing these kinds of events, going to conferences, so a broader audience, not just people within our own little spheres, but other people who could act on this knowledge and translate it into action. Kind of try and invest more in those venues as well.
There's a whole other piece to that that side of it. Okay, so a few minutes left. If there are any, well, I'll go for one last question, unless there's anything anybody wants to share before we go to it. So maybe just because this question came up a lot, and it's kind of a theme of this, of how do this evaluation is important. We talked about some of the methods and thinking, maybe going back to the local context and how you reflect upon that in the work that you do. Maybe just in a few sentences, and kind of how, I mean, you've talked about some of the qual methods, the quant methods, but how, I mean, the Accelerator Labs has so many people on the ground. Maybe it's just how, I mean, Katrin, you or alluded to some of the ways you already work with governments, but how do you bring in that local perspective in what you do, and just a short, because that seems to be coming up as a theme in a number of the questions. I don't know. Anyone want to come in on that? Eduardo, yes, please.
Yeah, how we tackle this. I mean, again, I mentioned this is a network ecosystem. Each of the labs are actually national colleagues that work and are embedded and suffer many of the consequences of the things they're trying to assess, right? So they are extremely locally embedded. And I think that's a great success in itself as a product, and a great way of making sure the local context is embedded into what we do. So that's how we approach that.
Sorry, that's a great example there. All right, okay, cool. So if that's enough, maybe if we can go for a couple more minutes. I didn't know if that was a question. To your point, I liked in your slides, Eduardo, and it comes up in some of the questions too, this tension between speed and rigor. So maybe how do we decide, there's all these different things in the matrix, and there's all these different, approaches. You can do an A/B test, you could do all of that. Maybe just some reflections on how you deal with that question. I know each project's different, each situation's different, but any thoughts or advice on colleagues just grappling with that question more generally?
Thanks. Yeah,
Thinking-
indeed.
Oh, sorry.
Yeah, please go ahead, Michelle. Yeah, I think it's
Sorry. I think for us, it helps to have the quick wins as something to build on. So, we don't want to overly focus on the short, quick, cheaper experiments, because sometimes that might not address all of the underlying constraints that we think are important to focus on an intervention. But kind of in our earlier work, especially as we were building up kind of the capital, let's say, to engage in larger scale engagements, we do find that those quick wins of a randomized letter experiment, so on, which are difficult on their own, but provide some initial evidence that this could be a valuable piece of feedback for governments to incorporate into their policy. We do find that can open doors for longer engagement, and it's really about relationship building, so that you can have more freedom to explore that balance between speed and rigor.
That's a great point. All the partners coming back in to play a role in what's needed and what's used and how. Anybody else want to comment in the last minute here on speed and rigor? No, that's all right too. Okay, I know Eduardo already spoke quite a bit to it, so if Katrin and Philip, you're good with that, maybe we can just close it out here for today. I think we've got most of the questions, and we've addressed some of them directly. But there's also one about, will this webinar be recorded? Yes, it's being recorded. We will share it when it's processed. It should be up in the next few days. And if you haven't joined the behavioral science group, I encourage you to do so. And there's lots of resources in the chat. I put Embed's website, UNDP Accelerator Labs. There's a lot from WHO Europe too, so lots to check out there. All right, and hopefully see you during Behavioral Science Week this year, and only about a month away. Okay, thanks everyone. Bye for now.
Bye-bye.
Thank you.
Thank you. Bye.